in the last session. So we'll be completing with this session. We'll be doing all the 200 questions in this session. So guys, I know you guys were waiting. I had got a lot of messages asking to upload all the 200 questions. I was a little sick, so that's why I couldn't upload it soon. But guys, I'll upload it now. Yeah, so quickly moving on to the next question. Question number 186. Autopsy in HIV positive patient. So autopsy used is Rokitansky method. Next question. It was mentioned in the question that it's a Rajasthani patient with skin lesions and a mastigote with kinetoplast. An image was given. So diagnosis of this is leishmania. Next question. Question number 188. A farmer with conjunctivitis and leptospirosis. So answer to that question is MAT. So I think this is a more appropriate one, guys. Next question. Question number 189. It was a question regarding Trichomonas. Regarding Trichomonas, true statement. So answer to that is twitching, motility seen. Next question. There's trauma history with a lesion in the orbit seen on CT. So answer to this question is I think the most appropriate one is pseudotumor of orbit, because the orbital margin was not crossed. Even though frontal mucocele was an option, but the orbital margin was not obliterated. The margin was very clear in the question. So I think pseudotumor of the orbit is the more appropriate answer. Next question. Colombo plan. So Colombo plan is regarding cobalt therapy. Next question. Hepatitis B treatment. Answer to this is tenofovir. This is a monotherapy used. And next question. Question regarding serous anastomosis. So this is again a controversial one, but I think the answer is left gastric esophageal, but it's a controversial one, guys. Next question. Chronic pancreatitis management. So this is also a controversial one. Pancreatico jejunostomy. Next question. This is a factual based question and regarding Mendelian inheritance. It's a very factual based question, and I think the answer is 2/3 is autosomal dominant, but it's a very factual question, so even I am confused. Next question. alcoholic patient with gout. This one again is a controversial one. So it can be either high lactate and high urate, or it can be low NADH NAD ratio. Okay guys, next question. So any of these two can be the answer. Next one. This was regarding corrosive intake. I think this is clear for you guys. NADH, NAD. Okay. Yeah. Corrosive intake with dysphagia. So answer to this question is feeding jejunostomy. This appears to be more better answer, but again this is also controversial, so that's why I did all the I'm doing all the controversial questions in the end, because there are so many of them. Next question. This was an image of a person who had done yeah, it's an image. So there was a hole which was shown in the neck, and I think the answer to this is standard tracheostomy, because the hole which was shown was at the lower part. So it is usually done in that way in standard tracheostomy. If there's a malignancy and all, we do it in a higher part. So I think this is a case of standard tracheostomy. Next question. Melanie's gangrene. So regarding this question, the answer, this is a previous year question. Like I have seen this question before while doing the previous years. So answer, I think this is a little older type of previous year, older one question, but from the previous year itself. So answer to this question is, the question was identify the false statement. So answer to this was hyperbaric oxygen therapy does not decrease mortality. So actually hyperbaric oxygen therapy will help in decreasing the mortality. So this option is false. Next question. Abdominoperineal resection APR for CA rectum is done. First major vessel ligated. Answer to this is sympathetic with retrograde ejaculation, but this is also controversial one only. So guys, we have done all the 200 questions now. So if there's anything I need to do after this, just let me know in the comments. I hope it's clear. If there's any thing to be added or any changes to be made, just let me know. Okay guys, till then, bye. I'll see you next time.